Hi guys, it's Dr. Amber from Primary Prevention Physiotherapy. We're here today to provide you a couple value-based exercise videos specific for common diagnoses that we see in the clinic. The most important thing is that if you are experiencing pain or injury, you need to get checked out by a PT first and foremost. A thorough evaluation can help us determine exactly what you need in terms of specific exercises for you. We hope that these videos, though, at least give you a place to start, so that way you can try a couple things at home. If it's not completely resolved with these exercises, feel free to come on into the clinic and we'd be happy to take a peek at you. So today we're going to be going over something really important that most people struggle with, which is called a hip hinge pattern. So typically when you see people squat down or sit down onto their couch, they have something going on. They either let their knees come over their toes, they let their knees come inward just a little bit. What we're going to focus on is the correct way to do this. So when you're doing a correct hip hinge pattern, the only thing that should be moving really is your hips. Your spine stays nice and straight, your legs can stay nice and straight until you get to the point where you maximize your hip mobility and your hamstring mobility. At that point, then you can start to bend your knees. When we're talking about a squat, what I would like to see is when you go down into that squat, those knees push apart just a little bit. So what I tell my patients is if you have a laser beam coming off your knees, it shouldn't come inside of your big toe, and that makes a nice stable base for your hips. Another thing is, I don't know if you guys can see my knees, but when I push my hips back, my knees never come over my toes. That forces me to push my weight back in my heels and forces me to use my big powerful movers in my hips. These big powerful movers are the lateral stabilizers of your hip, and they provide you a lot of power in those movements, right? So today what we're going to go over is we're going to go over a way to strengthen that hip hinge pattern. The way I just showed you a squat, getting up and down from a chair, or every time you use the restroom, stand up and sit down about 10 times. So if squats are hard on your knees or maybe potentially hard on your hips, this hip hinge pattern, this bridge that I'm going to teach you is a great place to start, okay? So I'm going to have our model here lie down on the ground. He's going to go down onto his back. He's going to tuck his heels as close to his buns as he can get them. And what I'm going to have him do is pull those toes up to his shins, so just his heels are on the floor. Yep, and all he's going to do, you can rest your head right on the floor so you don't strain your cervical muscles. All he's going to do is lift those hips right on up to the ceiling. Go ahead and go through a couple of those so they can see what it looks like. He goes ahead and he rests his back and his hips down on the floor every single time. This is really good, especially for people with low back pain, those who have trouble with push-off if they're running, those who have trouble getting up from a seated position. A way to progress yourself on this one would be to put a band around your knees or switch to a single leg position. So when he comes down, he's going to bring that leg right out in front. In the same concept, you're still just going to push right through that one leg. Just make sure you do an even number on both sides. We don't need one leg stronger than the other. So the most important thing to remember while you're doing these exercises is that it shouldn't cause any additional pain. If it does, come on into the clinic and let's go through a proper evaluation and let's figure out if there's any pathological reasons why you might be experiencing pain in this position.